Hi, everybody. This is Marcia Vaca, and I'm with the Family Care Compass. And I'm here this morning with a colleague of mine, Amber, because so many of you on the Family Care Compass have been asking about Medicare and how do you understand Medicare and what should you be doing as you care for your aging loved one and helping to guide them and give them some clue as to what's really going on these days with Medicare. I will tell you that much has changed since the mid 60s when Medicare and Medicaid, the federal programs, were passed by Congress. Obviously, Congress likes to tweak away at all of their legislation and programs over the years. So there's been a lot of tweaks. In fact, some of you know that I still carry a life health license for myself, and I actually used to do Medicare supplement sales. And as soon as Medicare changed gears, and besides Medicare A and B, C and D, and they started adding more to the alphabet soup of Medicare, I said, I'm out of here. I got better things to do. And you know what? The blessing of all that is I was introduced to our speaker today, Amber, who is a Medicare supplement specialist. She knows Medicare inside and out, which I'm so thankful. So I don't have to worry about it anymore. And Amber is someone who has helped me with a number of my clients and patients and families over. We were just talking, Amber and I, where we figure we've known each other now 10 years anyway, maybe a little more.
That's probably about right.
Yeah, probably about right. Long time. Anything over 12 months is turning into a long time for me.
I know, right? And it's going so fast. Oh,
Yeah, I love it. So, to begin our conversation on Medicare, what is Medicare? Who's eligible for Medicare? How do you get signed up for Medicare? How does Medicare work these days? I will also give you a little tip and hint. Amber and I have talked, and because we don't want to overwhelm you with too much information at one time, we may have a part two. So you might look at this as a part one educational program, and I'll let you know if we're going to do a part two. So, with that, I'm going to ask Amber to introduce herself to you, give you a little bit about her background and how long she's been doing this kind of work and how did she happen to fall into this field. So, Amber, welcome. I'm going to turn the floor over to you so you can tell us a little bit about yourself before we dig down into the details of Medicare.
thank you, Marcia. I'm glad to be here. I'm so glad we're friends. And we've been knocking around and back and forth and helping each other with different situations. And I'm really
Yeah.
glad for this relationship. It's been great.
Yeah.
To
Agreed.
give you guys a little bit of background on who I am. I have been working with Medicare since about 2006. So it's been 20 years so far. And how I got started with it was an interesting conversation. I was in a local, I guess you want to call it greasy spoon, uh, a restaurant, a little coffee shop. And I was there because I had been doing something in the near area. And heard two gentlemen next to me in a different booth having a conversation, and they were talking about Medicare. And I think one guy was trying to recruit the other guy. So when you start talking about have to have a life license, life and health, and you go through testing and this and that, my ear got real big because I was curious about what they were talking about. And one of the guys mentioned is that you work really hard during the fall, and things are a little easier during the rest of the year. So you're really wild for a few minutes, for a month and a half or so, and then everything settles down. I'm like, what is that about? And I thought about it because would make it easier during the rest of the year for me to spend more time with my family. So I'm like, sounds interesting. And so I started to investigate. Now, when I got going with doing Medicare care insurance plans. I started with one carrier. It's called WellCare, and I got working with them for a little bit, and then another carrier fell into my pocket, and then another one, and then one of the I guess you want to call the agent support people at one of the carriers, it was United Healthcare. They said you should work with a brokerage. I said, really? So he introduced me to the brokerage that I'm working with now. It's called Coots Deal Insurance Services. They're based in Fresno, but I have a satellite office here in Sacramento. And I interviewed, they talked to me, and now at this point, they give me training every year. They give me support. They have a back office for me that helps me to do things. Um, but I think the thing I love the most about actually doing this job is that people will tell me when I get done working with them, you have lifted a weight off of my shoulders because Medicare, is it complicated? Oh, yeah. You
Yeah.
actually have to go through certification every year to make
Yes,
sure
every year.
changes every year that have happened. And at this point, I'm kind of used to it. But I have had so many people say, I don't know how you stay on top of all of this. It's too much. I'm like, yeah, I know.
Yeah.
I don't know how I do it. I did it either, but I'm now in it. And I can do all of this with my eyes tied behind my back. It's just crazy. It's
I love it.
just all hanging around in there. So
Yeah.
the most important thing is I'm helping people have a better quality of life because I'm helping them understand what's happening with Medicare. Usually,
Yeah.
when you're 64 and you're getting your own insurance, the rates are astronomical, a couple $1,000s a month. And then when
Yes.
Medicare starts, I basically give them a raise. You're no longer
Yep.
spending, a couple $1,000s a month for your health
Yep.
insurance. You're spending the Part B premium, which is $202 a month. It covers 80% of your health care and most of your hospitalization.
Yep.
So you're putting people in a better position. That's what I love about it.
Absolutely. Yes. And I was in one of those positions. In fact, Amber's the one who helped me as I was coming into that wonderful age of being able to get onto Medicare.
Mhm.
I was so excited because I was paying, 1,000 or better a month for my health insurance coverage and came on to Medicare. And then when it came time to wanting to supplement what my coverage was under Medicare, Amber is the one that I went to assist me with that. And that's a perfect lead in then, Amber, for us to begin to talk very specifically now about what Medicare is all about and how Medicare actually works. So folks, we're going to take it a step at a time. I've told Amber we got to take it slow and not overwhelm everybody with too much information at one time. That's why there might be a part two, but we want to give you right now the very basics of what is Medicare. What did Congress pass back in the mid to late 60s that has been so wonderful for older adults, particularly those who are retired, as well as some younger people that if they meet certain medical conditions and qualifications, they can come on to the Medicare program as well. But I think for the sake of clarity today, we're really going to focus ourselves on the 65 plus group. And as you're working with an aging loved one who you're trying to support, who you're trying to have enough knowledge and understanding so you can be there for them and assist them. So with that, Amber, tell us, what is Medicare?
So, Medicare is a health insurance program that is nationwide. It is a federally funded program. Like Marsha was saying, it was started in like the mid 60s. I think it was 65 when it was introduced.
Past,
Its
yeah.
main function is to help people over 65 to manage their health care. As Marsha mentioned, sometimes it's for folks under 65, anybody with kidney failure, anybody with Lou Gehrig's disease, um, certain cancers, or anyone that is permanently disabled under the age of 65 for at least 2 years. They have eligibility for it. Now, you also have to have worked in the workforce for at least 40 quarters. here in the United States, or have been married to someone for at least 10 years who has that qualification, that 48 quarters, to be eligible to get Medicare. Okay. So, and those are some of the ways you get it. If you also, if you work past the age of 65, there is a way to get Medicare without having to deal with any penalties or any problems with it. When I work with my clients, I teach them the ins and outs of that. So that's getting a little too complicated, but we'll talk about mainly I'm eligible for Medicare, what's going on. So Medicare itself, like I said, it handles about 80% of your health care on the doctors and outpatient care side. Hospitalization, it does have a deductible. We'll talk about that a little later. But after that deductible, Medicare is covering the rest of your hospitalization. So it has two parts. It has Part A and Part B. Part B is your hospitalization. It is bed, food, nurses, and therapy while you're in the hospital. It does not cover the doctors. I'm not supposed to really get too specific on numbers in regards to the deductible, but it's about $1,700. Okay, but that's the deductible, and Medicare is covering the rest of your hospitalization costs.
And can I clarify one thing, Amber?
Sure.
What you just described, the hospital side of the fence for Medicare, that's Part A?
Mm-hmm.
Part A, okay. I thought I heard you say Part B, so I just wanted to make sure in case
It's Part A.
somebody else heard that. So Part A
Yeah.
is what she just described
Correct.
for Medicare.
And what Part A covers is acute care, like a major hospital. It covers skilled nursing and hospice. That's what it's managing for people. Okay. Sorry, I'm just gunky today. Part B is doctor services in and out of the hospital, and then outpatient care. That's going to be, let's see, blood tests, urine tests, CT scan, ultrasound, durable medical equipment, speech therapy, physical therapy, and then the ambulance and the emergency room. That's what Medicare Part B covers. Okay.
So it's basically the services that your own primary care doctor, while
Right.
you're just doing your annual physical exam, or if you end up with something that the doctor determines you need to go through further testing, then Part B then would cover that sort of testing as an outpatient, basically.
Correct.
Yeah.
And then also it does cover the doctors inside the hospital, so the surgeons
Right.
and hospitalists and specialists and specialists outside of the hospital when let's say you've got something going on with your elbow and you need to see an orthopedist. Part B manages that too.
Right.
It does have a deductible. It's about $285. Anyway, we'll talk about numbers later. We shouldn't talk about numbers.
And then I was going to say,
if this video was going on for a long time, my numbers would be wrong. So I'm not going to discuss that part too much. Okay.
Well, you know what? Here's the thing, right? Here's what happens. Here's what happens is that every year the premium for your Medicare coverage changes. It increases. And just about every year, not always, but every so often, the legislation that put Medicare in place allows for an adjustment in the deductibles, both for the Part A hospital side of the fence, as well as the Part B primary care outpatient side of the fence. And that's why it's hard to talk specifics about the numbers, because if you're watching this and it's 12 months from now, if we give you a specific number right now today, that chances are, in fact, we know without a doubt, yes, without a doubt, that the monthly premium that comes automatically out of your Social Security check, that will have changed. So we're not trying not to be specific. We're trying to give you the basic information so you understand, but we don't want to give you figures that are going to be incorrect.
Yes. When you actually sit down with a Medicare professional, any sort of Medicare insurance agent or broker, they will give you specifics at that time.
Yeah.
okay, about those numbers. So it's better for you to keep it kind of loose so that I'm not inaccurate.
Yep.
Okay.
Yep.
So, in regards also to Part B, um, straight Medicare handles all tests. If you have just original straight Medicare, it covers all tests, blood tests, urine tests. It's going to be your EKGs and your X-rays and that kind of thing, ultrasound. All of that is handled by Medicare, 100%. So you don't have to have any sort of co-payments, or at least you shouldn't. Okay. What else is going on with Part B? Yeah, that's basically it. Oh, and the deductible is only once a year. Once you've met it for the year, you're good. Now,
Good.
so Part B also covers 80% of your health care. So there's another 20% that must be covered, okay, or managed. And if a person has original Medicare and nothing else, they are responsible for those two deductibles in that 20% that Medicare does not pay. Okay. So it's a matter of managing those numbers and what do you do to do it? How do you manage it? Um, and now we're going to kind of step into how to manage that 20% of those deductibles. So
And
there
can
was
I and can I
interject.
pop in just real quick?
Sure, sure.
Amber said something about original Medicare. You're going to begin to hear as Amber goes into the different ways in which you can cover that 20%. And if you're talking to other family members, friends, or a Medicare agent in your area, then you're going to hear them talk and probably use the language of, well, if you have traditional Medicare or if you have original Medicare, those are usually the two terms that people use, or if you have regular Medicare. And it's like, well, wait a minute, what do you mean by original or traditional or regular? Those are all words that now are in our vocabulary. If you have, first and foremost, what Amber just described as Medicare A and B. That's original, traditional Medicare. And so now we're going to shift gears, as Amber said, to talk about, okay, if you have original, traditional, regular Medicare, how do you manage and handle what your out of pockets might be? That
Correct.
20% plus your deductibles plus whatever else. So just wanted to give you a cue because Amber's going to start using that word and I don't want you to be confused.
Let's see. And also, there's another type. Well, I'll get to that in a little bit. All right. So, if you have original Medicare, one of the ways to manage those two deductibles and the um, the 20% that Medicare does not pay for is to use what's called a Medicare supplement plan, or also known as Medigap. Now, anyone turning 65 is going to get inundated by all the documentation, all the paperwork for like 3 months before they turn 65. It's just crazy. So I'm going to try to keep it as concise as possible for you to tell you what's happening so that you are not overwhelmed. So when you work with original Medicare and what a Medicare supplement, a supplement plan handles that 20% that Medicare doesn't pay, and it can help with the Part A deductible. Okay. So if a person has a hospitalization, if they carry their Medicare plan and their supplement plan, the supplement plan will manage that deductible for you, and you'll have no cost to your uh, hospitalization at all, as long as you pay your plan premium. It's not free. There's a cost to it. But I would say the most efficient way for a person to get their health care covered as a senior is original Medicare and a supplement plan. Okay. Now, there are several different types of plans. They call them Medicare supplement plans as opposed to part, because you'll see that because there's letters involved there too. Um, but I would say these days, the most popular way that plans that people use are called a G plan, Plan G. And you'll hear that knocking around all the time. So what a G plan does is it covers the Part A deductible, like I mentioned. It covers that 20% that Medicare doesn't pay, but the consumer is responsible for the Part B deductible when they go to the doctor, but it's only once a year. Okay. But after you've met that deductible, all your care that you receive when you go to the doctor or to the hospital or therapist or whatever, it's 100% covered by both of those programs, as long as you pay your supplement plan premium and your Part B premium for your original Medicare. Okay. The other thing about original Medicare is it is a nationwide program. It is not in one spot. You can go to any state, you can go to any city, you can go to any town, any hospital that's willing to accept Medicare for payment. And so if, let's say, for example, you hear about, you're living in California and you hear about Arizona Cancer Center of America, you can take your original Medicare card and your supplement card and go to Arizona and get care for whatever condition you're worried about. There is no network. There is no network. It's literally what's called fee for service. And as long as that provider is willing to accept original Medicare for payment, the supplement has to pay the difference of what it's responsible for. So it gives you the maximum flexibility to get your care. So
Okay.
in California, one of the better places to get cancer care is Stanford University Hospital in the Bay Area in San Francisco. Some folks also like going to UC San Francisco. And you just go wherever you want. So that's the nice part. It's very, very, very flexible. Now, one little caveat, it will not necessarily, it does not cover your medications from the pharmacy. That's a whole separate animal. We'll talk about that another time. But for main purposes of this conversation, that's the strongest type of health plan you can get as a senior.
Okay. Okay. So that's the most, it protects your out of pocket.
Correct.
Okay.
So,
So Plan G, supplemental plan to supplement your traditional regular Medicare,
mhm,
that's going to minimize
you're out
to
of
the max
pocket.
your out of
Even if
pocket.
your hospital stay is, $700,000,
Uh-huh.
as long as you are paying your premium,
Right.
Medicare and the supplement will manage those costs for you, and you will have nothing out of pocket.
Okay.
Now, this is
So the
strictly for healthcare, though. Go ahead.
Yeah. So again, for someone who's, getting all those letters as you're closing in on age 65 and needing to consider Medicare as your primary health insurance carrier,
Mhm,
you get all that information through the mail. You start getting all this information about all these supplemental plans. Um, and again, like Amber said, looking at that Plan G. So, just to be clear, Amber,
mhm.
with people who do go on Social Security, the primary Medicare monthly premium is pulled out of that Social Security check before you get that direct deposit
Correct.
of your
And
Social
they
Security.
actually and there's a special letter they'll send you that talks about your benefit. It tells you,
Right,
okay, so we're gonna take this amount from your Social Security income and pay for your Part B, and then the rest of it will be deposited to your account.
right.
Um, Now here's one
Okay,
little caveat. If a person's not taking their Social Security yet, but
right.
they still wanna get their Part B, they're not ready because they wanna get the maximum income. You
Yeah,
can do that, absolutely, but you're paying privately for it. And Medicare will be billed on a quarterly basis, or if you
right.
go into your Social Security account and set it up, you can actually do direct withdrawal from your personal account until
Yeah.
until your Social Security kicks in.
Until you kick into Social Security. In fact,
Correct.
that reminds me, because I held off, I did not take Social Security at age 65. but I did pop on to, of course, Medicare at age 65. And so you're right. I had to pay quarterly for those Medicare premiums until I finally decided a couple years later to begin the draw on my Social Security benefit. And then
Right.
it shifted. And then my premium came out of my Social Security check automatically. So the pain of paying whatever that monthly Part B premium is out of your Social Security check, it's like, it's not quite so bad because you don't see it to
You don't
begin
see
with,
it. Yeah,
until
it
you
just you
get
just
to
get
the
the
end of
difference.
the year, yeah, and you see your statement. We've talked about the premium for Part B. Well, we know there's a Medicare Part A. So you keep talking about us paying our premium for Medicare Part B. What's going on with our Part A
Okay.
coverage?
Okay, so if a person has once again worked in the workforce for at least 40 quarters or 10
40
years,
quarters. Okay.
um, your Social Security taxes have paid premiums for Part A already. So you
Okay.
don't have to pay those at all.
Okay.
You don't have to pay them.
Okay.
It's just as though they've already pulled it, you're all good. Period.
Okay, so it's 40 quarters, there's 4 quarters to a year, so you have to have 10 years worth of pay of employment paying into the Social Security program.
Yeah, and it
Yeah,
doesn't have to be consecutive either, as long as
right,
it's that
correct.
number of months of quarters is fine.
Quarters, yeah. Okay, good. Okay, I just wanted to make sure that we were
Yes.
clear on that with people, that your Part A, uh, premium is all based on your working years and your working quarters, 40 quarters, while
Mhm.
as your Part B premium will either be paid, out of your own pocket if you're not on Social Security benefit yet. But once you're on
Mhm.
your Social Security benefit, it automatically gets pulled on a monthly basis out of your Social Security check before you even get the rest of the money coming.
Yes.
But
Yes.
the Medicare supplement that you might want, you're paying typically monthly.
Mhm.
Sometimes
Out
you
of your
can do it
pocket.
quarterly and annually, but I mean, typically, let's go with the monthly focus here. You're
Mhm.
paying monthly for that Medicare supplement, and
Right.
you're having to make sure that supplement payment is paid.
Yes,
Okay.
correct. Most of the
Okay.
carriers wanna do automatic withdrawal from your checking account or credit card or
Yeah.
whatever. You just
Yeah.
want that directly.
Yeah.
That's the preference. As a matter of fact, they sometimes a carrier will give you a little tiny discount on the cost of your premium for letting them pull the funds directly from your account.
Sure. Sure.
Just
Okay. Okay. Good. Okay. I think I've got that. I think I've got that. Okay. So now, Amber,
Mhm.
I did not go with a plan G. I went with something called a Medicare Advantage plan.
Yes.
What's that?
Okay. Now we're gonna pop in the other direction. So when you have what's called a Medicare Advantage plan, I'll describe what it is. It is a privately held insurance carrier that has set up a plan that does at least what Medicare Part A and B are doing, at least. And what happens is that that company will set up a contract with Medicare, and they agree to follow the rules and regulations that Medicare has prescribed to them. So
Okay.
they call that plan Part C. Okay, so
C.
with C is in Charlie, and so it's kind of silly to say it, but basically A and B together create Part C. And you'll hear that, and you also hear Medicare Advantage. And what happens is Medicare is paying that company, that insurance
Okay.
carrier, money for every person that signs up on the plan, whether they go to the doctor or not. Now, how
Okay.
I describe it is kind of like, you know how you pay your auto insurance premium? You don't get in accidents every month.
Right.
Okay. But you pay your auto insurance in case something happens. So there's a bucket of money sitting over there just for your car. Okay. Well, it's kind of like this situation. Medicare is paying the insurance carrier to cover you. Okay. And you're the car. And so
I've been
that
called
will,
many things, not a car, but that's
yeah,
okay.
but
I'll
yeah,
take
you're kind of,
that,
it's just, yeah, I'm trying
yeah.
to say, it's an analogy. So Medicare pays the company sets up a relationship with medical group or medical providers in a particular city or county or zip code. And they have that medical group and the supplement and the carrier will have an agreement of who gets paid what and how. So they have to
Okay,
have an agreement. Okay. Um,
okay,
and when that happens, they have all the providers in that medical group that are available to the patient to get care from. They want to get from the medical group because the medical group is who pays the doctor. Okay.
okay,
Let's
got
say
it,
there's a person and their doctor's here and they go to the doctor. Hi, doctor, and I'm having a problem with my pinky toe. Come on in and we'll take care of you. Well, the doctor reports that to the medical group. The medical group reports that to the Medicare Advantage plan. And the Medicare Advantage plan says, okay, here you go. We're going to pay you for that service you have provided to that patient. So the
okay,
medical group pays the doctor. Now, the main thing about this, when you have an Advantage plan, there are some restrictions that you might have. So one of those things is you got to stay in the medical group, especially if it is what's called an
in the
HMO.
network,
In
in the network,
network. You got to stay in network because if you go outside of the network, let's say there's a specialist over here, but they're not part of this medical group here. They're not going to pay this doctor because they're not part of that medical group. So you got to stay in the box with them. I say it that way.
yeah, yeah,
Um, if you the only way they will pay outside of that medical group is if there is no specialist available to do the specialized work that you need, the specialized care you
right,
need. And then
right,
they go outside, but it has to be
right,
pre-authorized by the Advantage plan to allow people to do that. And that's actually directed by your doctor. Okay.
yeah, so, that's sounding an awful lot like an HMO, what
That's
we
kind
call
of what they
health
are.
maintenance
They're yeah,
organization.
there's different versions, but right now it sounds like an HMO. It kind of is.
Yeah,
There are PPO type plans, which means
right.
that you have to
What's a
they want you
PPO?
to cross with the
I'm
boxes
gonna
open.
yeah. What's a
Preferred provider
PPO?
organization.
Okay,
That's
preferred provider organization,
correct.
PPO.
Correct. And what that means is they have a group of doctors that they have as preferred providers, right? But and there's this little box, they're in the box, but the box is open. So someone can go outside to another provider outside the network. It'll typically cost you more money to do that. And also that provider has to be willing to accept that plan as a PPO for payment. It doesn't
Right,
always work. They don't always want to do it. Okay.
right,
Um, so uh, they're available, they're around. There doesn't seem to be very many, at least in our area here in Sacramento. There's one or two.
yeah,
But they mostly want people to stay within the system.
within the
Another,
system, yeah,
another situation. Medicare Advantage plans cover prescription drug coverage most of the time. So
okay,
that's basically a type of it's called Part D or prescription drug coverage. Or, yeah. And what happens is that company will set up a contract with certain pharmacies like CVS or Walgreens or well, they're not around anymore. Who else? Yeah,
all those wonderful pharmacies that
Costco
are
has a pharmacy. Okay,
yeah,
so they set up a contract with the pharmacy to provide um, preferred pricing on medications. I'm not going to
right,
go too far into this because it's too much to it. But the Advantage plan will handle your hospitalization, it'll handle your doctor's care and services and therapy and all that kind of stuff, and your prescription drugs.
right,
Not only that, though, that's just the Medicare part. It covers some things that Medicare does not cover. Medicare doesn't cover dental.
right,
Um, they cover, they don't do vision either. They don't do glasses, and they
right,
don't do hearing aids. And so sometimes the Medicare Advantage plans will set up special programs for the consumer to be able to have access to those kind of benefits. So they might have dental at a discount. It might have hearing aids, a benefit, so lower cost on hearing aids. And they'll also do, let's see, glasses. They'll have a benefit to go towards the cost of frames and lenses and stuff so that you can get glasses too. Medicare doesn't cover those things. Now, in regards to vision, it will cover ophthalmology. Like if you have a condition with your eye, let's say it's macular degeneration or cataracts or whatever. So that's within the health plan itself. That's covered there. But through a doctor, through a specialist. But for glasses, if you're trying to do that, that would be a separate program within the Advantage plan. Okay.
Okay.
Um,
Let me share this a little bit from someone who's had a Medicare Advantage plan. I think most people can begin to understand the basics of, having Medicare, regular, original, traditional, Medicare, and then buying an additional plan to cover your out of pocket and your premium cost. And
mhm,
that makes a lot of sense to people. I personally did not go that direction. I did go with a Medicare Advantage plan. And so just to give you an idea as to how that actually has worked for me on a couple of new health issues that I never have had before in my life, is I've ended up in an emergency room at a hospital, acute care hospital, that is outside of the network of my Medicare Advantage plan providers. Okay. So, how that actually functioned is that hospital had to reach out to my health insurance plan, my Medicare Advantage plan, and even as I was sitting in the emergency room, they had to get permission. They had to get approval to either continue to serve me, or they would be told by the plan that they needed to get me to an in network hospital. Now, I was lucky, based on the situation, and I was able to stay in the hospital that the ambulance took me to. And my Medicare Advantage plan did cover that. And it's all based on, what was going on medically, what was happening to me, and the hospital, ER team seeking permission or approval, I guess you want to call it approval, to continue to serve me and to take care of me.
mhm.
So that's been a blessing. Okay, that's so I don't want anyone to think that if you're on a Medicare Advantage plan and, within your home environment, if you have to go to a hospital because of the medical need, that your Medicare Advantage plan won't cover that other hospital. I've
That's correct.
also been yeah, I've also been faced with, having to seek, some medical care through a doctor outside of my Medicare Advantage plan group, my in-network people, and, that has worked just fine as well. They have to seek approval in order to serve me, but that's not been an issue. So, um, Amber, what have you found to be true before we move on to a slightly different topic related to all of this? But what have you found to be true as people say travel? Say, I've got family in Boston. If I did, I don't, but I do. If I had to go to Boston and I have
Mhm.
my Medicare Advantage plan, what would happen if I ended up needing any level of urgent or emergency care in Boston?
Okay, so how that works is that they don't want people to feel like they have to fly all the way home when they have a health problem. Okay. So if you have an urgent situation where you've hurt yourself or you're feeling kind of really sick, not hospital level, but really sick, you can take your Advantage plan anywhere to cover an urgent situation. And then if you have an emergency where you're like extremely ill, like practically life and death, you can go to any hospital anywhere, okay, where
Right.
you are. So you don't have to worry about travel. And actually, in some situations, actually, most situations, if a person is traveling internationally, their coverage expands out to to whatever country you happen to be visiting um, for emergency care. So you don't have to worry about whether you're covered outside your town in another state. Urgent and emergency care is covered. Now, don't decide you're going to have your annual exam in New York. It's not going to do it. They're not going to pay for it.
Got
You
it.
got to do it at home within the regular network.
Right.
But,
Right.
yeah, emergency stuff, you don't have to worry. You'll
Right.
be covered in
Okay.
like
Okay.
Marsha's situation. I think I wanna add one little caveat, just in general, not specific to travel, but when a Medicare Advantage plan helps a consumer, Medicare is paying that company, so they've shifted the risk from Medicare to the plan. So,
Right.
that's when you'll hear someone say, "Well, you're not with original Medicare." You're still a Medicare patient, that's not gone. Okay,
Right.
it's just these guys are handling it for you. A lot of times, Medicare Advantage plans are much less expensive than a supplement plan by a lot, although I have seen them sometimes almost as expensive, but not lately. And having to, um, it's all a matter of choice. What's important to you?
Yep.
And that's actually really important to have a conversation with a professional because we're aware of what medical groups are doing, who's accepting what type of thing, who's happy to have a Medicare Advantage plan, what company or organizations like, "Oh, we do not do Medicare Advantage plan under any circumstances." It really is a mixed bag. So working with your Medicare professional is really important so that you can understand what the situation is. They help you make sure you stay with your primary care doctor or whatever specialist you want to see. They look at all aspects of your health situation and try to provide you with the most logical solution.
Yeah. Let me piggyback on that too, Amber, because folks, this is one of the areas that Amber shines as far as I'm concerned. She has been so helpful, not just for me, but many of my clients in understanding what that medical group that maybe you've received care for 30 years, in the same medical group, same group of doctors, they've got all your history, they've got all your records, and suddenly you're coming onto Medicare. Then you're looking at Medicare subs. Then somebody's talking about a Medicare Advantage plan. And you're like going, I just want to be with my doctor. You know, this is where someone like Amber, who is a Medicare insurance specialist, and she knows the plans and she understands which medical groups, right, are on each plan. Because to be honest with you, there are some of these insurance plans that work better with different medical groups than what they do work with other medical groups. And so I often tell people if they can't immediately find someone like an Amber in their community, to call the doctor's office. If you're having a tough time making a choice and you don't know exactly which way to sort of go, at least make that call. Gather the information, gather the data, talk to somebody in your doctor's office and find out, hey, if I went with such and such plan, you know, will you accept it? You know, is that a great thing? Or can you tell me the top, two or three plans that you like to work with? Most doctor's offices will tell you, um, at least I have found that to be true. Maybe as a case manager, they tell me as a case manager, but I have found my families that I've worked with have done that. So they've gone and done a little research, as I call it. They've researched, they've talked to their doctors, and they have found out what that doctor's office has worked with or has, as their list of insurance, providers and companies that they will accept. And that is important to do. So when you do then sit down and talk to someone like Amber and you're trying to make a choice between, this plan or that plan, G plan or Medicare Advantage plan, you can have all the information you need. So you can make an informed choice. But that becomes so critically important sometimes for folks, right, Amber? Because
Yeah.
they've got medical providers, they want to stay with their doctor. And so you have to make that choice. And it's not always straightforward or easy
Yeah,
to make
it's
the
not always
choice.
straightforward. It's like if a
Yeah.
person's watching television and they see a commercial for a Medicare Advantage plan, and they say,
Yes.
"Oh, that sounds great. Maybe that's the place to
Yeah.
go."
Right.
Hold up, little buckaroo. Don't go. Don't call. Don't answer that phone. Don't call that number. You need to talk to an agent or what's I'm actually a Medicare broker. I have a relationship with multiple carriers in this
Yeah.
area. I actually work up and down the state of California. I have clients everywhere. Okay, down in Los Angeles. I've got folks in Riverside. I've got people up in Napa. I've got folks in Marin County, everywhere. And each area has their own plans with their own groups that have made agreements with those doctors and whatever
Right.
that means, right? So
Right.
one medical group may say, I only want to work with this plan, this medical advantage plan, Medicare. We
Yeah.
don't want just that one. We have that going on here in Sacramento with Sutter County or Sutter Medical Group. Um, and so you have to use those plans. So whatever you're seeing on television may have absolutely nothing to do with your favorite medical group or your doctor. So
Right.
just choosing based upon what you see on television, don't do it. Find a local professional. Do a Google search. Do a Yelp search.
Yeah.
Find someone that's got a good reputation, and you also specifically would like to work with a broker because a broker has a relationship with multiple carriers. We know where the flaws are, we know where the warts are, we know where the good things are, and how things work, and that whether they've got good ratings or not, or a good history. All right, what do you
Yeah.
want to call it? Reputation. Okay.
Yeah.
So
Repetitions.
working with a broker, that person is working on behalf of the consumer, not on behalf of the plan. Okay.
Right.
So I am very neutral, basically. I
Yeah.
know who's doing what. And I'm like, well, if you want that plan, that's not this plan only works with this group. So your doctor's over here and this within this plan. So you can't have that plan. And
Yeah.
you're gonna be really unhappy when you lose your
Yeah.
doctor and your specialist. Don't do it. Don't do it. Don't answer. And I'm not gonna try to diss the 800 numbers in those commercials. But if you're talking to somebody in Nebraska and you live in Sacramento, they don't know what doctor groups are here. They don't know who
Yeah.
they are. I over
Right.
the time that I've worked in this business, I know a lot of the major doctors in the area within
Right.
different groups. I know who's doing what.
Right.
I know who's an independent physician. I know who's part of a specific medical group, and that's all they're doing. It
Right.
we know that stuff, and we want to make sure that you make the most advantageous choice to yourself as you can.
Right.
So find a broker. Don't 800 number. Oh,
Yeah.
don't.
Yeah. Yeah. So
I've had
yeah, this
people leave me. I've had people see TV, see an 800 number, call it, lose their plan, lose their specialist, lose their doctor, doesn't cover all their drugs, and they call me crying. Amber, oh my God, I saw that
so
commercial. I thought it was great. I thought it was going to be wonderful. I messed myself
I
up. Can you save
know.
me?
I know. You know,
I frequently have
yeah.
saved them from
Yeah.
themselves. It's like,
So, I think the point of all this is again, you want to find somebody in your local community who knows, and like Amber says, is a broker, where their focus as a broker is to work with you as the consumer, as their client, as their customer, and to help guide you through what's going to work for you in that area. Now, Amber, I know, serves more than just the state of California. She is licensed and registered in a few other states, but you do need to find someone within your local area because even for me choosing my plan, I had to find somebody first and foremost that I could work with who covered my primary geographic area of where I live. And so that became part of my conversation with Amber when I was trying to figure out, which plan do I go with? Do I do a Medicare Advantage for me personally? Just in full disclosure, the reason I chose my Medicare Advantage was because of the premium cost. I was tired of paying 1,000 a month, for coverage. So that is just so important. And I think what Amber shared with you in terms of taking a look within your own local community for a Medicare broker who's
Mhm.
got a good reputation, and don't listen to all of the hype between all the paperwork that's going to come to you in the mail or come to your aging loved one in the mail, and it's going to sound so good. And the stuff you see on TV or even online, because when you start Googling online, you folks already know the algorithm's going to catch up with you real quick. And if you start trying to help mom or dad or grandpa or grandma find a Medicare supplement plan online, your feed is suddenly going to become all this Medicare supplement insurance plan stuff, and it just comes at you, and it all might look well and great and good, but it's only when you really talk to somebody who knows your local community, knows the doctors, knows the hospitals, and knows what carriers are really providing most of the insurance to the medical groups within your area. But
Mhm.
always, like I say, as Amber said, go find that Medicare broker who can really help guide you for your own local community. There's one other area, and then I think we're going to wrap. I think we need to do a part two, Amber. I don't know.
Yeah, I
I think
think
we
you're
need
right
to
because
do
there's
part two,
I have my
but
list of things,
I know
and
we've got this
I
huge
don't
long
I
list.
think
Yeah,
we've only covered like
I
2 out
know.
of the 7.
Yeah, two out
Um,
of whatever. Yeah. So let me maybe have you discuss just briefly as we wrap up part one today. Um, in terms of your experience working with family members who have older loved ones, they're trying to support them, they're trying to help them. People who have listened to me talk for very long, they've heard me say always get your documents in order, get all your legal documents in place, have everything done you need to have done before the crisis hits. And
right.
that includes having an advance directive or a power of attorney for healthcare.
Yes.
And we've talked about how if you have that and you're the agent, you know, uh, the power of attorney for your aging loved one,
Mhm.
then it helps you in terms of you're trying to help them kind of
Right.
thing. Well,
Mhm.
how does an advance directive for healthcare or a power of attorney for healthcare, how does that intersect with what they're trying to do as they talk as the family and their loved one talk to someone like you, like a Medicare broker, in terms of being able to make this decision on which health insurance plan is going to be best or not?
All right. So when I have a situation, a lot of okay, here I'll back up a little bit. I have clients that I've had for a very long time. And after a certain point, their adult children will reach out to me. Hi, this is so and so's daughter, so and so. Um, my mom's having a problem and she is struggling to remember stuff. And so we are trying to step in and help her. Um, so in those circumstances, I will ask the person, do you have a power of attorney? If they don't, and mom's memory's starting to go, I say, go to an estate planning attorney immediately, and start working that out because as a person's memory starts to decline, it could go slowly, it can go like bad. You don't know. You don't know. It's important to do that, and that's for all the major stuff. Okay. Now, if a person's already in the hospital, and I've just had this situation happen, and they need help, the um, The medical directive is for that specific instance. If the doctor can see or the medical staff can see that that person is incapacitated, that's for that specific situation of being in the hospital. Advanced directives don't apply to health insurance. It's going to in regards to a specific situation. So if your loved one is having memory issues, if it's hard for them to make decisions, um, it's important to set up a power of attorney and make sure that, there's maybe one or two family members that are listed. Go to your estate planning attorney, get it done. Don't hesitate because it could be a split second and suddenly mom doesn't know who you are. It's not good.
Right.
Um, so, um, if you have a family member that is a bit frail and you're beginning to notice they're repeating stuff or they're having cognitive issues, please don't hesitate to get that taken care of as soon as you possibly can.
So
Um,
can you use then that power of attorney or advance directive
yes,
to
I can.
change the
The
person's
thing,
insurance coverage?
yes, not the advance directive, power of attorney. That's
Okay,
what I so what I have people do, if I know this is the situation, I have them give me the declaration pages with the notary seal on it, signed by the person and the agents for that patient, and I
okay,
keep a copy of it, and I keep it in their file, and so if I have to make a change to a health plan situation, I have it on file. If the carrier asks me, "Oh, do they have a power of attorney for, you know, Barbara to do this for Miss Agnes?" Yes, they do, and I'll send it to you. So if there's a situation, your agents should be asking you for a power of attorney to keep on file electronically, in case it is needed for making health plan changes for your loved
okay.
one.
So like for me right now, I don't think I've been incapacitated, but you never know. I could actually put on file with you as my broker. I could give you a copy of my power of attorney for healthcare,
Mhm,
which names my agents who can
mhm,
speak on my behalf and make
mhm.
decisions, healthcare related decisions on my
Yeah,
behalf if I do become incapacitated. I
correct.
could actually give that to you now. You could put that in my file in the event that down the road, if something does begin to happen to me, I can't speak for myself, I can't sign my name anymore, I can't
Right.
tell you what I want to do, then you would be able to use what's in my file and speak to my attorney, my agent, in fact, that's what
That's
they're legally called, to make changes in my insurance coverage.
that's correct.
Okay.
That's correct.
Okay. All right. So I wanted people as we sort of wrap up part 1 here. I know because so many of you as caregivers, you've heard me, like I say, you've heard me sort of pound the drum of really helping your loved ones as well as you to get all of your legal documents in place to identify those key decision makers that would step up if something did happen to you or to your aging loved one. And I wanted you to understand that that's where, when you get to talking about Medicare supplement plans, whatever that might look like, be it Part G or some other alphabet soup, or or in a Medicare Advantage plan, that you understand that with that document you can again have the flexibility to really assist your loved ones as
Mhm.
their conditions or situations change, as long as your Medicare broker insurance agent is able to have a copy of that and have it in the
Yeah,
file for your loved one.
absolutely.
So yeah. So with that, I think we're going to wrap it for today, but we promise you, my friends, we will come back to part 2 because believe it or not, we have a number of other areas to discuss, particularly diving into open enrollment periods and what's going on with open enrollment periods, or if you move your loved one from one county to another county or one town to another town, what's that doing,
Yeah,
to what existing Medicare coverage that they have. And then also the whole element, if you've got a loved one who's in a skilled nursing facility, a nursing home, or an assisted living, sort of a residential home. Again, what's going on with all that? So we've got more to cover, but we don't want to overwhelm you. I'm sure you
Yeah.
already are feeling overwhelmed to some extent. That's
We
okay. That's
probably
perfectly
have I
normal.
probably have
Perfectly normal.
another 45 minutes worth of stuff.
Yeah.
So
I hate
don't
to
you
say
you
it,
don't
but
want your
yeah,
eyes glazed. Don't not gonna
amen.
have your eyes glazed over. This is not a good
That's
scene.
right. That's right.
That way it just
So
bounces right off.
we'll end the conversation for now. I would highly recommend for those of you that are watching this video, take notes, take notes along the way. And if you want to reach out to me, I will definitely take your questions, get them to Amber. I can connect you directly to Amber. Amber is in California. She's in the Sacramento area. But Amber, real quick, what other states are you licensed in to serve?
Of course, California. I'm also able to write business in Arizona, in
Okay.
Nevada,
And
and
Nevada
Washington State.
and Washington State.
I'm
Okay.
considering Florida. I have too many people going over there. They're saying, "Hey, we're moving to Florida." I'm like, "Oh my
Oh,
god!" Okay. And
Florida.
I had to find
Anyway.
somebody for them, but I've had too many people do it, so I'm
Yeah.
actually
Yeah. Yeah.
considering going
I
ahead and
love it.
doing it. So,
Okay. So again, I did explain to Amber that I've got many, many people in our community, in our school community, that live all over the United States. But Amber is available. She's a member of the school community. So you can get on the chat button with her and ask her your questions directly, privately. So go look in the school community for that. If you're not part of the school community, then just reach out to me. I'll make sure you know how to reach me, and then I can put you into contact with Amber. But Amber, thank you. I mean, this is so much, and I know there's so much more in depth that we could go into, even with
yeah,
what we've covered briefly this morning.
yeah, so I'm banging
And
on my
but
head.
that's okay. We're okay. Yeah, we're okay. Thank you so much for your time this morning. Thank you, folks. And
It's been
we
my
will be doing a part 2 soon. So let us know if this was helpful to you or not. I will be posting this within the school community, the Family Care Compass, but I will also be posting it on my YouTube channel under my company name, Vaca Associates. So you can check it out either place. And Amber, again, thank you so much. And we'll look forward to meeting up again to go on to part 2.
It's been my pleasure, Marcia.
Thanks.
Take care, everybody.
Take care.